It's very nice to meet you.
Thank you. Thank you, guys. Thank you for the warm welcoming. Thank you, Dr. Khalid, Azza, Dr. Nader, indeed. Just a quick question before start. Is there certain rules that I need to know for the meetings, muting, the camera, close the camera, leave the camera on? Any of these rules I need to know?
So if when we start, if everyone mute except the presenter, after presentation you can use the hand for raising your hand to ask question or add comments. If you can do that, that would be great. Otherwise, yeah, it's optional, the camera on, off. That's a good question. Welcome, Sarah.
Welcome.
Assalamu alaikum, Dr. Nader.
Alaikum salam wa rahmah. Very good. How are you?
How is everyone?
Everybody good so far.
Alhamdulillah.
So, Azza, you are on.
Okay.
You are ready.
All right, guys, welcome to our meeting. It's June 12th. Welcome to the new fellow, Dr. Mohammed. I'm gonna be presenting today how to choose an article for how to choose a journal for your article. I'm gonna have to share my screen before I start. All right, are you able to see my screen?
Yes.
Yes.
Okay, perfect. All right. Obviously, when we have an article on your hand, manuscript, the next thing to think about is a journal, a specific journal to publish your article. Okay, there's a few tips here on how to choose a journal. Of course, you have to make a list of the available journals, either by consulting your peers, searching through online listing, or using any online tool. We have here a great tool. It's called Jane. I'm gonna have a look at it after the end of my presentation. I'm just gonna give you brief tips to look at it when we are doing the actual going through the Jane application. Okay, so what factors are we looking for in a journal? The first thing to look at is the impact of the journal. The impact of the journal is, how do you know the impact of the journal? There is some certain things to look for. One of them is the impact factor, the journal rank, the article influence, and the H index. The impact factor means that it measures the frequency with which the average article in that journal has been cited in a particular year. So it's a number. Let's say you have an impact factor for a specific journal of 4. That means in a particular year, this journal has 4 articles being cited. Okay, it's 1, 2, 3, 4, and the impact factor of 10 is an excellent number. The journal rank, the article influence, that means how many times this article have been cited. The H index is also measures, it's the rough summary. It actually measures the researcher productivity and impact. The productivity of the researcher is known by the number of papers the researcher has published. And the impact of the researcher means the number of citations that the researcher papers has received. All right. So make sure the scope of the journal and the policies matches your need. So we need to look at the subject covered of this journal, the type of articles published, the target audience, because a paper is published for a medical field is different for the papers that is being published for the general population. Okay, so one tip I will give you that to go through the editorial policies and the practice of the journal before you actually publish your article there. Again, check the journal requirement and the distribution. Most journals have a certain style for the article. They may want you to do some things. They may need to do some numbers of number of papers, number of words, and also you need to look at the mode of the distribution of this journal. Is it an online or a print? How many subscribers in the journal? And you need that to determine the reach of the journal. You need also to collect an information about the peer review process. So it includes the stature of the reviewer, the objectivity, and the timeline should be collected from a variety of resources. The estimates of also of the rejection rates would be helpful to obtain. Okay. One last helpful tip is to check the instructions for author carefully. Each journal has a specific instruction they want you to abide with, and it gives you an additional information before you submit your manuscript, either page limit, preferred topics, etc. All right, we are now ready to go through the Jane tool. I'm gonna have to exit out. Do you have any questions so far before we start going through the tool? Anybody?
Yes, Azza.
Yeah.
You've just mentioned the impact factor, that it's out of 10, or did I hear that incorrectly?
10.
Yes, so it's from 1 to 10.
Yeah, it's from 1 to 10. Ideally, 10 is an excellent number. So when you find the average impact factor of a journal, it's 1 or 2. This is an average number. It's not a low number because it's measured annually or every 2 years. Okay.
Yes, that is clear.
All right. If you look at the Jane application, can you see? Okay. Okay. Let's say I want to search for article, or my article is about COVID or COVID vaccine. Let's say I want to have an article about COVID vaccine. Okay, I'm gonna write here the COVID vaccine, find journals writing about the COVID vaccine, or find authors, or find articles. I'm gonna see here, find journals. All right. Okay, those are the names of the journals. New Scientist. If you see at the right of the screen, the article influence is 1. Okay, the article influence, that means how many times these articles have been cited. Journal of Public Health, Oxford Journal, also 1. If you want to see the article here, the specific article, you can look at it from here. Okay. Let's see, I want to look at the highest impact or the highest article influence. It's here at Morbidity and Mortality Weekly Report, Medline Index. This journal is currently indexed in Medline, so it was reviewed by NLM at some point in this time. However, authors should assess the journals listed to ensure they are not predatory. Okay, so If you press this, you can see the article. And if you want any similar article, you can see. It's actually an excellent tool. It will save you a lot of effort and a lot of time. And you kind of make a list very quickly when you look at it like that. You can have an idea like which journals are interested in your manuscript or your article, and you make a list of them. Okay. Okay, when I did that, export citation, I'm just trying this with you all guys, fellows. Okay, it will give me an option so I can save the specific article. All right, do you have any question? Do you want me to go any further with this application, or are we good? I'm gonna share the link with you in the in our app. Okay. All right. Anybody had a question?
Yes.
Go ahead.
Thank you, Azza, for this demonstration. And my question is about contacting journals. If you remember, we have the issue of we targeted to we have targeted two journals or during the AMDA and AGS meeting. And if you can give us your opinion, maybe, or anyone else, Dr. Nadir, maybe can give can provide us with his opinion also.
Yeah, thank you, Ali, for your question. Actually, I was wondering the same, and it's a kind of I don't know if Dr. Nadir can give us his perspective about this.
Thank you so much for the nice presentation and very informative short demo. Thank you so much, Azza. And thank you, Ali, for the question. So for us, when we submitted the abstracts to AMDA, the conference and the AGS conference also, they have the conference one side on one piece. So when you present there, it will count as a poster. So every conference you can present and you can list that as a poster. Some of these entities, let's say AMDA, they have the meeting and they have their own journal. So if they have their own journal, then some of them take all these abstracts and put it listed in their special edition or some edition of the journal. So in doing so, you will be listed as an author for the abstract, and it will be searchable in the PubMed or the journal itself if you want to look at the website. That goes for AMDA, that goes for AGS as well. In other conferences, you will be presenting the poster, and it will be just listed in their like list of posters without putting it in a published article or paper or in the journal if they don't have the journal. So you can verify that when you send your abstract to these conferences and see what if they have a journal and if they publish the abstract in these journals. So some do, some don't. And this is the easiest way to publish if you want to put your name in these journals. So you just participate by sending an abstract and it will be listed. Did I answer your question correctly or clearly, Ali?
Yes, absolutely. Thank you for clarifying on this issue.
You're welcome. And for Mohammed and Sarah, if you want to add Any comments, or if you have questions, you can go ahead, or you can use the hand also. Thank you.
Thank you, Dr. Nader. Yeah, definitely. Mohammed and Sarah, you can go ahead and interrupt us at any time if you want to ask a question. You're welcome.
Thank you, Azza and Dr. Nader. Thanks, Azza, for your good presentation. Just I would like to have an insight about the publication fees. Like, do we usually pay for the journals to allow us to publish in their for us, or they are like free journals? Thank you so much.
That's a great question. I'm gonna jump in as if that's okay.
Yeah, definitely.
So that's a great question. So of the list that Azza made using the tool, the Gen, you will look at all this journal and then identify which one you want to submit your article to. Then if you go to their website, they will tell you some of them you have to pay fees to publish, some of them will be free. So it depends on if you have a budget for paying for publication, then you can go ahead with the journals that accept payment. If you don't have enough, or you don't have any budget for publication, then you go for the free journal. So it's all options out there.
Yeah.
That's a good question, Sarah. Thanks.
Thank you so much, Dr. Nader. I appreciate that. Thank you.
Yeah.
Thank you, Dr. Nader. Thank you, Sarah, for the question. And talking about the budget, I guess Khalid has a presentation about that, how to write a budget. Are you ready, Khalid?
Before Khalid start, Lubab, I think you raised your hand. If you want to
I'm
ask
sorry.
a question, or
I'm
maybe
so sorry.
no,
No,
that's
that's
fine.
fine. That's fine. Thank you. Thank you, Azza, for the presentation. Thank you, Dr. Nader and Sarah and everyone for your input and questions. Following up on your explanation, Dr. Nader, so our submission for AGS now considered for publications, or we don't have information about that? We know that it has been presented, all of them.
So I have, yeah. That's a good question. So I'm not sure if they published, they came up with a journal with a special edition. I think they put their abstract there, if I'm not mistaken. We can look at their 2020 or 2019 conference and posters and see if they published them in the journal. I'm not sure, I'll tell you the truth, but you can look that up.
Okay, thank you so much. Because I
You're
remember
welcome.
for AMDA, they reached back when they published actually through email about the abstract that they published for us. So
sure.
It's good to know that information. Thank you so much.
You're welcome. But so far, I don't think they published it because I didn't see it on PubMed, but I might be wrong. Yeah.
We will keep an eye on that. Thank you.
You're welcome.
Yeah, thank you, Lubaba, for bringing up this point. Okay, Khalid, whenever you're ready, you can share your screen and start your presentation.
I think
yes,
Sumi, I think, has
wanted to
Khalid.
ask
Sumi,
Khalid,
Sumi
sorry.
has a question. Sorry, Khalid. I don't know. I can't see your hands when it's raised. I don't know. So,
yeah, that's okay, Aja.
Sorry.
Yeah, thanks for the presentation and everything, and everybody's input. I want to just clarify the AGS abstract submission and publication. So before the presentation, like I think 2 to 3 days before the publication, so there was a link that I think I shared that with the WhatsApp group, that our publication number is that, and it was published. And also I received a book from the AGS that from the publication, but it's not our abstract. It's mostly the Mostly I think the what do you say, like it's not the abstract, but it's the whole manuscript presentation. Yeah, oral. So but the rest, but all the abstract already has been published. I will look at it and I'll send you, I'll email all of us in the group, or probably in the app, if that's okay.
That's okay. Thank you so much.
Yeah, that's great. Thank you so much, Tommy.
Mm.
Thank you so much. Yeah. All right. Anybody else want to ask anything?
Yes. I wanted to run this by you. Is it true that when you are aiming to publish, you usually aim for a journal with a high impact factor, and then if you got a rejection, you go lower, and so on? Is that a good method to publish?
Well, I don't know if I can answer, but it makes sense that you go for the highest impact journal because you want your publication to be seen and cited. But yeah.
So that's a good question, Khalid. So usually you want to see what's your audience, what your target audience who will benefit from your article. So that's first point you consider. Then when you have the list of journal using the tool, then you look at what impact that the journal has. So you can rank the list of journal. And then you will ask about if you have money or no money. So you will target certain journal out of this list. If you have the money, you can go for paid like submission. So you want to go through steps in putting your list. It's similar to when you apply to the ERAS list of programs. You will have your list and you want to see which one is perfect for you, location, which one is comfortable, number of applicant like international in that program, something like that. So you will have certain point in your head when you make your list. And then you go from there. So if the first journal you submitted, they don't accept for any reason, then you go back, you go to next one and so forth.
May I add a question here?
Yeah, go ahead.
Also.
Yeah.
Is it true that the higher the fees you pay for the publisher or the journal, the least the peer review and the possibility of rejections? Because I'm hearing this here and there. Some journals, they just want to publish and make money out of the publications, so they will have a higher fees, and accordingly, who's ever willing to pay will get his paper published. Any thoughts on that?
Based on your yeah, I think it's individualized. So I think the last article we published, we went through healthcare. It's a journal, I think, in Europe, and they are paid and paid high, like the fees is high fees. But we went through the reviews, so they reviewed us. They went back and forth to correct here, add here, edit here. So I don't think it's just for benefit only. And it came as a good one, the final version of the paper. So I think some of them might be just commercial, but some are really well documented as far as publication and so forth. If you follow the recent, like when COVID started, some journal, big journal, Jan, is it New England Journal or they published some articles for some medication and then they retracted that. So it's kind of, is it commercially driven? Is it just they want to publish? it's hard to say, but I think some of them, yes, some might be. So I think it's individualized. Good question. If you want to comment,
you.
what's your experience, if you have any, when?
No, I myself, I don't have publications, but I have a friend of mine. They try to publish because part of their career, especially as a tenure track faculty members, their own experience. The higher the fees that you pay, the least review, peer review, and the least chances they will reject your publications. They might have a reasonable fees, but you still have to go through this back and forth editing process.
Yeah.
Thank you for answering the question.
You're welcome. I just want also to add, when we finished the manuscript, the first version, we submitted to one journal, and that journal, they just rejected from the start. So I'm not sure if they have fees or not, but it did not match what they want or focus on the duration or time when we submit it. So sometimes you also get rejection, not because your manuscript is not good enough. It depends on what their focus in that time period when you submit it. If it matches their goal, then it will be easier to publish in that journal. If not, then you will be rejected. And it's not because you have a bad manuscript.
Thank you so much.
You're welcome. Thanks. Okay.
Yeah, sorry, I just jump in. And yeah, I agree with Dr. Nadir, and I recently also submitted in Journal of Urology. And what my experience is like, yeah, it was when I submitted for the first time, yeah, fee was there, but it's a good impact factor, journal. So it is reputed. But what my understanding is like they did not reject my our manuscript for the first time, but they have some questions regarding our data. And also there are 3 reviewer, like peer reviewer. They have I think they compare our data to some of the other institution or something, so they have question about that. So when I answered their questions, then they said that they're gonna accept it, but they did not they did not reject it. So it took me for this whole process, because when I answer back there, we as a group, when we answer back their question, they have some other question. So it took us like 6 months, but finally it's published. So sometimes that happen, like they have question regarding data, regarding the results sometimes, and some statistical questions. So especially the reviewer and editor. But after that, it's not like always they reject because of like they want to make money. That's all I can say, especially the renowned one, I guess. So that's my experience. Thank you, and sorry I jumped in.
Thank you so much, Sumi. Thank you, Dr. Nader, for the clarification, and thank you, Sumi. And I guess it's multiple factors that we have to look at, not only the impact of the journal, the budget, the process of the peer review. And so out of your list, and consulting your fellows also who are publishing the same kind of research will help as well. Okay, I think we are ready for you, Khalid.
Sarah's hand is up, I think.
No? Okay.
Lee and Sarah have, I think, raised their hands. So.
I'm sorry, I guess I
sorry,
have a problem in seeing that.
That's all right.
I don't know
I can help you.
Okay. Okay, go ahead, Sarah.
Okay, thank you, Azza. Thank you, Dr. Nader. I would like to share my input about like publication rejections. So I had last year one of my articles that been rejected like around multiple times from many journals. And I used it, of course, was like stressful for a long time, but I used the feedback to further modify my my study, my article. So like the rejection reasons can help us to further improve our article and our manuscript and add the missing information they're asking for, even if it's rejected for another time, and then we can move on with another journal. And so that's it's kind of a process, like we can take it in a positive way to further improve and learn and to improve our manuscripts. I think there's a website in terms for budgeting. I had eventually to publish by paying money for publishing fees. But this website has like around, it was a reasonable price, but and it also provided with peer reviews. Like we had to have like around 3 to 4 like attendings to review our manuscript before it's published on the website, and it eventually gets PubMed indexed, like published on the website, and then within a couple of months it becomes PubMed indexed and become a peer review article as well. So I think it doesn't have to be related to how much we pay. For instance, JAMA, or I tried to publish for the Infectious Diseases Journal of Medicine. It was costing around $1,500, which was like almost like 1 month salary. So like, no, it's not going to happen. Okay. But also I've been looking for advice from my colleagues who have better research experience with me than me. They mentioned that if a journal has 2 options to publish, like a journal has the option to publish as a free source, like it's available for everybody to read, then it would be costing us fees for us to publish. Otherwise, if we can choose like to be like subscribers only, we will not pay as much for publication. So these are my inputs in terms for rejection and budgeting for the publication fees. Okay, thank you so much, everyone.
Thank you so much, Sarah, for sharing your experience. Okay.
Ali, I think, has a question or comment.
Okay.
Yes. Can you hear me well?
Yes.
Okay. I think this topic is very important. I mean, for every researcher, everyone wants his hard work to be published and be seen. That's why we had so many interactions today, Azza. Anyways, my question is that I have seen Sarah and Sumi having so much time to publish their abstract or manuscript. So my question is that what is the average time maybe for someone, I don't say an average manuscript to be published? I have heard that Sumi said maybe 6 months. So is that an average or too short or too long? Thank you.
Can I go, Ali? I mean, Aja. Sorry.
Yeah, sure. Sumi, go ahead.
Yeah. Sorry, I'm still sick. I'm trying to recovering. So Ali, that's a very good question. It depends on like your manuscript, you know, like if it's accepted the first time, it may publish in like 3 months, but every journal has their own criteria. So, you know, you cannot, you have to just wait for their own criteria, because after acceptance, some journals they publish in 2 weeks, some journals they published in a month or 4 to 6 weeks period, something like that. Other thing is like, if it's not accepted, sometimes they don't reject, they don't accept, like my case, you know, so they have some question for my results and for my data. So from the editor and reviewer, so when I address my questions, I mean, you know, their concern, and then they accept it, and then so that's why it took 6 months, because you know, when I sent back to them, they came back to me like it's took a while to sort out their, you know, like answering their questions and their doubts. So that's why it was 6 months. But at the same time, I published a case report also. So that was accepted in fast shot, like they did not have any question. So as soon as they accept, it's like took 3 weeks to publish. So, you know, that's the whole things, I guess. Thank you, Ali.
I see. Thank you, Sumi. And I'm glad that you can join us, and I hope you are feeling better now. Thank you for the illustration.
Yeah, thank you, Sumi. Get well soon. Okay. I still cannot see any raised hands, but if anybody is raising their hands, they can go ahead. Otherwise, Khaled. Okay, go ahead, Khaled.
Yes, can you see my screen?
Yes.
Okay. I'm going to talk about the research budget. It's going to be a very brief presentation. I'm just going to walk you through the different subheadings of the research budget and how to properly justify it. You will need to develop a research budget, whether you have funding or not. Any research, whether a small project or a very large project, should have a research budget. So all research needs financial support, whether it's basic or applied research, whether it's clinical or non-clinical research, they all need financial support, no matter how much you think the project is small. Even if you are just doing online surveys, for example, these still cost money, because you have to think about internet charge, the communication charges, and many other fees that will come up when you start the work. But before you actually start the work, these things might seem easy to you, but when you actually get down to carrying out the project, you will need to have already done a specific and to the point financial report. So successful grant winning requires two key elements, as we know and we've discussed in many presentations here, in how to have an innovative research problem. It's also equally important to have an appropriate planning of your budget. So the purpose of the budget plan is to demonstrate. Can you hear me?
Yes.
Okay. Sorry, because I'm having internet problems here. To demonstrate the required cost for the proposed project, to plan for funders on how the organization will operate the project. It's also a great guarantee for the funders when they see that your project, when you see that your budget is listed and planned out well. That means the project is going to be planned well as well. So it helps both the institution and the investigation team in the management of the project itself. So what constitutes a research budget? Research budgets are similar. They all have the same subheadings. First, there is direct cost, which are costs used specifically to carry out the project. Direct cost includes everything you are going to do in the project, um, including personal, which means the wages for the people that you will need to hire for your research project, even your own wages. Everyone working in a research project should have their own wage, or to be listed as an author, but you cannot recruit someone in a research project without having to pay them or listing them as an author. So you should do either one of these. Recruiting expenses. I'm sorry, reoccurring expenses. Reoccurring expenses are variable and keep on occurring throughout the entire project duration. To give you some examples of these are like consumables, chemicals, glasswares, lab test charges, any diagnostic kits you may need, stationery, telephone. So it's everything that you are going to keep on doing throughout the project, These are reoccurring expenses. Then there is non-reoccurring expenses. Non-reoccurring expenses are those which are one-time in nature and which uh, do not recur at regular intervals. Particulars included in this category are equipment or instruments with its accessories, for example, software, computer, printer, or anything that you will only need once, so you don't have to redo it every time throughout the study. There is also traveling expenses, which usually take a lot in the budget if your project involves traveling, of course. The budget allocated for traveling can be used for attending meetings, conferences, workshops, and training programs. So basically, these are the direct costs of the project. The second thing which is very important to consider is the indirect cost, which is also called the overhead charge. These are the costs which cannot be directly attributed to specific expenses of a project, but are required to run a project. It's also termed as overhead charges. Indirect costs are figured as a fixed percentage of the total direct cost. A common percentage being used here is 10%. It's really hard to exactly estimate the cost of your project. So that's why you put this overhead charge, because some expenses occur during the project that you want to cover. These are two general tips. Expenditure should, as far as possible, be given in units, so you have to be specific. As I've said, for example, when I've said that traveling is a direct cost that should be accounted for, you should exactly know the distance, how much each trip cost, and you then go and accumulate these and you put it in the traveling cost. So you must precisely know the units you are using here. Salaries can be calculated against full-time equivalents or per hour according to qualifications. This is different from a country to another. It's also from a funding agency to another. And also it's important to know that not all funding agencies provide wages or provide personnel costs. You may only have your direct cost covered, except for the personal cost, of course. Another thing is to be realistic and don't overinflate the budget, but also do not try to underfund a project in the hope that it will be funded. What I mean here is that you don't lower your budget as to guarantee yourself the funding. This is not the best way to get funding. You should put exactly the number that you need and be precise about it. So budget justification is equally important as the budget itself. So after you listed the budget, your direct and cost, and then you added your indirect cost, you have to justify every item you have put there. For example, if you said that you need to travel from a state to another, you should exactly write that in the justification. Why exactly are you traveling? For example, to collect data or for training or so on. Most of the funding agencies require submission of a budget justification with all the items described. Break down the consumables item-wise and year-wise with its cost and calculation according to the protocol of the study and justify accordingly. These are simple steps to create your budget, because when you actually start writing your budget, you don't know from where to start. The first thing you should do is know your protocol in and out. You have already created your research proposal. You know what you have to do. List all the things that you are going to do. Take your methodology and turn it into a step-by-step plan. After that, check the funding agent rules, cost each item, put in a spreadsheet, and then justify it. This is a budget example that I'm going to share with you. Yes, can you see this PDF file?
No.
Oh, yeah.
You can stop sharing the screen and
Yes.
then redo it again.
Can you see it now?
Yes.
Okay, great. So this is an example of a research budget. As you can see here, these are personnel costs. This is the principal investigator. These are 4 PIs. This is the amount they request for their wages. As you can see here, you just list the equipment cost, the travel cost. You don't explain anything here. You just list the items. Consultant, subcontract, whatever you need, which depends, which is different from a project to another. And then you put your total project cost. Before that, of course, you need to add the overhead charge, which I talked about earlier. The overhead charges differs from a program to another or from a university to another. It's usually around 10%, but it's sometimes more. You add that and then you get the total project cost. Here you can see an example of justification. So as we listed earlier, the senior personnel cost, here it's saying that there is 1 primary investigator and 2 co-investigators. So it's just basically justifying who are these people, what are they going to do, and why did I write that number exactly. So we must be really clear when we are justifying the budget, and we should justify every item. I know it's sometimes you don't have an exact amount. You should put your estimate and provide evidence of how did you arrive to that estimate. So that's basically how to prepare your budget for your research or grant proposal. I'm sorry, I've had unstable internet connections. At times I didn't know if you can hear me or not. If you have any questions, please feel free to ask.
Thank you so much, Khalid. Your presentation was clear. I think we didn't have any problem hearing you. Thank you so much. Just one question or clarification just for me. Is the budget justification the same as grant proposal? Is it the same? Or do they have like different rules?
No, the budget justification is you just justify the items you've put in the budget. The grant proposal, well, it has of course the research proposal and the amount you need and so, but I'm talking here specifically about the research budget itself. So
Okay.
you're just justifying your budget. It has no relation to your of course you do that after your proposal, after you build your protocol.
Yes. Right. Thank you so much. Thank you, Khalid. Anybody has a question for Khalid?
Mohammed.
Go ahead.
Yes, thank you, Khalid, for the great presentation. It was really fantastic. Just a quick question, or maybe a clarification about the overhead expenses. Try just to understand it better. The way I understand it is some kind of extra cushion you add to the budget you're proposing in case of extra expenses. Is it that way I understand it, or something different? Thank you.
Yes, thank you for your valuable feedback. The overhead charge is usually a fixed percentage. Let's say, for example, 10%, that after you've arrived at your total, and then you add that percentage. This is to cover what is known as hidden cost. Really, when you are planning for a project, you try to be as precise as possible, but when you start doing the work, there are different fees that you are going to have to pay. that it's hard to plan from the beginning. So that's why it's there. It's a safety net, so that the budget at the end can be as to finish your project without having to add any further fees.
Great. Thank you so much. I got it. Fantastic.
Excellent presentation, Khalid. Thank you so much, and thank you very much for your question and answer. I just want to add a couple of points. I want to share with you first my screen. Okay. So one thing you mentioned is the item number 2, or the second step. After you put your protocol, you put your itemized cost expected. Then I think you should look at the rules for the offering, or the one who offers you are submitting your proposal to. For instance, at MSU, they have funding or award for geriatric proposals. So in their role in this, for instance, they can tell you what the fund will be supporting or they can accept to pay for, and then what are the limitations. So for instance, here they can pay for anything except this itemized or these points. So you cannot pay for graduate assistantship. So you can pay for a student who's undergrad to help you, let's say, if you want to hire them in the summer for your project, you can say, I will pay them minimum wage per hour, and I'm expecting them to work 5 hours a week or 20 hours a week. And then you calculate that, and that will be accepted for this type of funding. But if you want to do the same with a graduate student, then they will say, oh, in our rule, we cannot support graduate students to do this type of work, and so forth. So you can, in some awards, you can buy gift cards for the participant. For instance, in this one, they don't accept gift card, but they can give green checkbooks, which are green checks. Like you can write a check for the participant, but you don't buy them a gift card. In other places, you can use gift cards for incentive, for examples. So you want to look at the rules for the one who provide the money for your project before you submit. When we started this project last year, I did not pay attention to all the details. And when I asked for money, I got emails back and forth, like, why do you want this? I want to explain. And then they will tell me, oh, go to the rules, and I'll find out, oh, I can't use the money because of the limitation here and there. So it will save you time when you study or when you read carefully the rules, the limitation for the acceptance of the budget that you propose. Thank you, guys.
Yeah, thank you so much, Dr. Nader. And I think you were suggesting also to do a grant proposal for the COVID vaccine, and we tried, and we actually started on it, but we found out that we were not eligible. Yeah, but I think out of practice, we should like continue doing that. I think it will be beneficial for us, maybe. Or maybe we'll do an actual grant for something else.
We can do that in the future with some of the projects. Definitely. So I think there are plenty of money around there, but it depends on networking, and you look up or look for the matching your proposal with their agenda or their goals. Thank you.
Yes, thank you so much. Any other question?
I just want to add one funny we are trying to collaborate with some people from Germany, and we had a meeting last week, and they mentioned something about the project they did. And when they started, the principal investigator was thinking out of the box. I'm going to explain. So their idea is to help people who need medical needs in an emergency situation. Let's say there is a tourist that fall, and EMS was called to assess the patient. If the patient speaks the same language, that's easy. But if they speak a different language, let's say they are French and they are in Germany, then the EMS either they have to use translation or get some way to understand the patient to ask them the basic question and then take them to the hospital. So the principal investigator, when they built the app, they did that, and they went not to the health and ministry for funding, but for agriculture ministry. And the reason for that, they said, in urban areas, the EMS can go there and they have internet connectivity. They can use Google Translate or some other ways, immediate translation. But in rural areas where there is no internet availability, then they have to use some way of an app in their device. So we need to build that app, and we're gonna use it in rural areas. So for that reason, it's accepted to be covered by the agriculture for their app to be developed. So it's kind of a neat or out of the box thinking when you target your funding sources. So just to share with you guys. Thank you. Ali, I think you have a question or raising your hand.
Yes. Thank you, Dr. Nadir, and thank you, Arif, for the presentation. I just would like to ask about the budget design that Arif showed us. Is it the same across all projects? I mean, going to do a research or maybe other projects like vaccine awareness or whatever the EMS you told us about. Is it all the same, or it differs maybe from one institution to another or from one project to another?
So I will answer before Khalid. If Khalid, you are ready, you can answer. Oh, go ahead. I will follow up.
I'm sorry, because I had to use the data. The Wi-Fi was disconnected. I didn't hear the question actually.
Yeah, can you please ask? Can you repeat your question? Yeah.
Yeah, sure. I was asking about the budget design. Is it the same across every institution and maybe any project? For instance, writing a budget for research or maybe for other projects like vaccine awareness or whatever. Is it
Well, regarding the design, it is the same because I've came across many budget examples and they all just look the same, yeah, with the same subheadings, just maybe a very little difference in there. But regarding the rules of the funding, that's different from an institution to another. This Dr. Nader will know better, of course, the rules of different funding agents.
So to answer the question, yeah, Khalid, you are right. So basically, the template is the same for most of the proposal. If you want to submit your proposal for the budget, the question is in the detail. Let's say if you are working in a lab and you want to get animals to test, then your details about how to buy the animals, how much it costs, and how to hire people who will work in the lab for you, something like it will be the details of that particular project in that particular lab. if you are working in a project where you want to ask participant humans to get involved in the research project, then you will itemize that. You will hire some people to call these persons and to educate them about the project, get the consent, whatever, and then they get enrolled. And then at the end of the project, you can give them gift cards for participation, or in the situation of the rules that we just showed, you can write them checks for their participation or for their time. So it depends on what exactly you want to do. As Khalid mentioned, if you are working on printing stuff or using computer software that's particular to your need, it's not like available like Office or something you can download online, something like that, then you can put that in the budget for certain stuff. So it depends on the details for your specific project. But the template, the requirements, as Khalid mentioned, they are big itemized group that most of the proposal will be included same way. Thank you.
Thank you both, Dr. Nader and Khalid.
Yeah, thank you, Dr. Nader, and thank you, Khalid. Thank you, Ali, for the question. Okay, anybody else has a question, or if you want to jump in to add anything? Okay. All right. Moving on to our next part. I think talking about that, how is the vaccine awareness going on? We needed to touch base with Lubaba. Any new ideas, anything that we're supposed to do?
Thank you so much, Azza, for bringing out the subject. And thank you, Khalid, for the great presentation. It's very informative and a great discussion too. Regarding the vaccine awareness, actually, I did reach out to SAPA, and they requested that the panel that's going to do the awareness, we need like to send them pictures and everything. And I think I initiated a conversation on the WhatsApp to see if we can meet and plan, since we postponed it for after Eid. So I think it's time for us to gather and see what's the appropriate thing to do. I will need to confirm the participant now, since the past batch, I don't think all of them will be able to join now. So we can confirm the members that they're gonna participate, and then we will take it from there. So the idea is like just Q&A sessions, and I think it is a good time since the vaccine is somewhat is available now in Sudan. I think Ali and Khalid can, Roa can update us in that area too. We can maybe focus on the vaccine that's available in Sudan and try to learn more about that and be ready for a Q&A session. But we should start now and prepare. You're welcome with my ideas.
Yeah, thank you so much, Lubaba. And I think you're right. We need to ask, because we're targeting Sudan. So we need to know from fellows in Sudan, Ali, Khalid, and Ru'a, what are the issues that faces the vaccine, the COVID vaccine in Sudan, and how would they suggest we can approach this? I know Saba, they have their Facebook page. They usually do that stuff on their Facebook. It will be interactive, and they will get the questions live on their Facebook. But I don't know the access of the SAPA is not for the public, so everybody attending is going to be in the medical field anyway. So just I was wondering if Ali and Khalid have any suggestion for us so we can proceed in the right way.
Yes, regarding the vaccine here, it's AstraZeneca, the only one available here. I've heard that the Chinese government has donated the Chinese vaccine. I do not remember its name, but it's mainly AstraZeneca here. Yeah, and it is true that the vaccination rate is quite low. It's hard to pinpoint on the problem exactly. We need to maybe talk to some administrators in the Ministry of Health, which we can do. And we also have contact with the COVID-19 task force in the ministry, so we can see their insights, and then we will provide you with a better insight regarding the vaccination here.
Yeah, that would be great. Yeah, we need to know exactly what's on the ground and whether the people need it in terms of awareness. Okay, Ali, go ahead.
Yes. Regarding which platform to use, I believe there are many besides Facebook, and it's not important that to be in Saba only. It could be public, I believe. Saba may do a webinar that is public for all. And also we can, I don't know, maybe the TV. I think we can ask them either the Minister of Health or directly go into the, I don't know, soon or maybe anything. We can reach them out. We have the health program every Friday that's I think. I don't know if it's still working or not. But I think mainly Facebook and TV are good options, I believe.
Yeah, thank you so much, Ali. I think, yes, you're right. We need to think of doing our own. SAPA is only one way, so we can think out of the box. We need to be more reachable, so the awareness would make sense. You are right. Okay, so you and Khalid, you're gonna collect information for us. What do you think people need to be need to hear? What kind of questions that you like you'll be familiar of what kind of questions or what kind of fears that people have against the vaccine? That would be helpful. And the TV is an excellent if you know somebody who can give us access.
Thank you,
Yes.
Ali and Khalid. I will jump in here. I think I noticed there is some programs in Sudan TV. Mind? Do you hear me, guys?
Yes.
Yes. Not now.
Yes, Lubaba, go ahead. We cannot hear you now, I think.
I think she disconnected or something.
Yeah, I think we lost the connection of Lubaba.
I just want to add one thing. Maybe if we started asking some patients or maybe anyone from public, why are you hesitated to take the vaccine? The same that I think Sumi did. So to know beforehand what are the concerns and what are the difficult parts to address them beforehand. Maybe we can start by maybe yeah.
Yeah, that's a great idea. If you could take like random 10 persons around you and can ask them, are you vaccinated? If not, why? Like randomly. And we can like take a look at the answers and see what area that we need to target, if that sounds good.
Can I suggest something?
Yes, of course.
Yeah. So like before going to that, my first of all, I think it's America, as my project is in, although it's underserved population, but still the vaccines are available, right? Like if somebody come and say like, hey, I want to take the vaccine, it's available. But the problem is, like Asian and African country, my question is that vaccine available to everyone? So let's say like, we can talk about vaccines hesitancy when the vaccines are available. If the vaccines are not available, I think, like people will ask like, okay, I want to take the vaccine, but is that available for me or accessible for me? So that's one thing we have to, like think about. And probably another thing is, as Ali or Khalid, I think, mentioned that Ministry of Health. So in every country, I think they should have some data, like how many people are going to vaccinate in next couple months or 3 months, or at least how many vaccines are going to distributed for the whole country. And like how many people they are going to, what's their priority. Let's say like in Bangladesh, anything below 40, they cannot have the vaccine access, they cannot register themselves, because now their priority is 40 and above. So a lot of my friends and who are working and all that, they're physician, but they do not have the vaccine access yet because they are under 40. And and so like 40 and above, I think in 3 months what they're talking about, same thing like probably China, only they have now AstraZeneca, but probably they are Bangladesh government is trying to get some vaccines from China. So yeah, it's there, but still the hesitancy is there, where like people believe that this COVID-19 started from China. So they have a bias that, oh, China is going to make that vaccine, we are not going to take it. So that's a rumor, and we have to overcome that rumor too. I'm not sure, like probably Sudan, I mean, this is a general like ideology for the people. So there is two things. One is like the vaccine, when the vaccine available, then we have to work on vaccine hesitancy. And before the vaccine is available, we have to work the pre-hesitancy, or like like our pre-work. So and another thing, I'm sure that lot of you have lots of colleague or friends are working there. So what you can do is, let's get a target, like a one clinic or something, whoever is working in a hospital. So we can survey some questions like 1 to 10, and ask those patients or whoever visiting that clinic or hospital, like how do they feel about the vaccines, if the vaccines is available to them in 2 weeks. And and then we can have an idea. Let's say 50 people, like Ali or Khalid, they collected like 2-3 clinics over like local area, and get the people data, like what's their concept about the vaccine. If the vaccines are available, they are going to accept it. How many people or how many percentage they are going to accept it, and how many people are still says no, if the vaccines is available, I'm not going to get it. Or how many people are thinking like, if the vaccines is available, I may think, but I'm undecided. So we can just categorize 3 things, and then we can go from there. So the people who are going to accept vaccines, we don't need to talk to them if until they have unless like they have any question, like the side effect, or like general question when I'm going to get the immunity and how many, something like that. But the people we need to work on, like who never considering the vaccines, like still it's available to them, or they are undecided, means they have still they don't know much, that's why probably they are undecided, right? So these are the work we can do, like ahead of these things. And like collaborating with your colleagues, and like local clinics and local hospitals, and get this data. And still, like if there's the data, we can, the questionnaire, if they reach out to some people, and still we can publish that at a things, or in a clinic we can target 1 or 2 clinics, and we can reform as a like a QI project. It's called quality improvement project. Like the people who are coming to visit that clinic, everybody is vaccinated. That should be our goal in 4 months. And then how to counsel them, and how we can increase their vaccination rate. So we can do like I think I present that like a PDSA cycle: plan, do, study, and action. So we can plan, and then implement that, do, and then we study, and then we take the action. So if our things doesn't work, then we have to do something else. If it works, we'll repeat the same thing again and again. So that's my idea. Sorry I took so much time.
Oh, thank you so much, Sumi. Thank you. I think the vaccine is relatively available in Sudan. at least in the big cities. But yes, we need to collect data. So we're pointing out Ali and Khalid to do that for us. And they're gonna provide us with the data that we need. Okay, Lubaba, go ahead, you're raising your hand.
Yeah, thank you, Azza. I tried to jump in, but my internet was not helpful. I was just adding to the point of the platform that we hold the session on. I believe the Facebook SAPA can make the, I think the webinar public, and it will give us the chance of having live questions from the audience that we can respond to. In addition to that, I believe the national channels in Sudan, they are trying their best of making like awareness about the vaccine. And I believe the big issue in Sudan is hesitancy. Compared to other African countries, I think we had a similar supply from WHO. Other countries reach out for a second supply, but we're still having, as far as I know, less than 33% people that vaccinated. So, and I think the awareness, we need to focus more in having COVID as a disease compared to the vaccine. So since, as Somi mentioned, that we don't have a variety of vaccines there, but only one vaccine. So we need to focus on you have to be protected from the disease by whatever that is proven to be a protection at the current time. This is my point that I want to add. Thank you.
Yes, Lubaba, you're right. Thank you so much. Thank you so much, Lubaba. Anybody else wants to? Okay, Mohammed, go ahead.
Yes, I'm just trying to get an idea of this great project, but from what I just understand now, one of the biggest challenge we're facing, and try to summarize it into based on what I just hear today. First would be the availability of the vaccine in Sudan, if it's available or not, to cover the entire population or at least a targeted group. And this question, I believe, we can answer from the health department or the PHC in Sudan. The second question, which is is the message getting to the public? You mentioned Sudan TV as well as or national channels and Sudan TV channels, as well as the Facebook maybe. Is the target group really listening to Sudan national channels or using Facebook? Because definitely when it comes to COVID, you're talking about, high risk group above the age of 40, 45. And these groups, not only in Khartoum or in big cities, definitely we need to analyze the message itself, the channels used to send the message. Is it reachable to everybody, or just targeting maybe those who live in the city where they have electricity and they have TVs to watch, right? Different than using maybe radio or using any community communication like in the mosque or any kind of community leaders sending the message. So analyzing the message itself, is it getting to the public about the vaccine, the advantage, the disadvantage, the possible side effect? In addition to that, the hesitancy, as Lubaba and the other lady, I try to remember her name, Somi, if I'm not wrong, mentioned, which is even here in the United States, people try to find answers, to find somebody who can answer or address their concerns, safety, especially of the AstraZeneca. Because what I do know, a lot of people in Sudan, they're well educated, but still they hear there's some side effect comes with this vaccine, and nobody willing to, or there's nobody to answer their questions, what the possibility, the risk, and so on. So this is kind of the quick thoughts I just gathered, or basically have based on what I just hear. But I'm just a newbie today, trying to just understand what's going on. Thank you so much for the opportunity.
Thank you so much, Mohammed, for your input. You're right. I think the access to the vaccine and the health facilities in Sudan, of course, has deeper issues, and the COVID vaccine is one of the lightest one. But due to that, I think we need to focus on the awareness. People better be safe than sorry. The disparity of the accessibility to health to everybody is like very difficult. So why not like people get vaccinated and at least get one thing of their shoulder. Yeah, Dr. Nader, go ahead.
I think Ali has raised his hand.
Ali, okay.
Ali?
Yes. I would like to comment on Muhammad's question. Yeah, you are absolutely right. But I think as a beginning, we can target big cities like Khartoum, for instance, because if you start with the Sudan as a whole country, I think, as I said, there are many issues. Is the vaccine available or not? Is it accessible? I don't know if the temperature is suitable for the vaccine. I don't know if there are refrigerators. I think that would be a big project. And I think, I don't know, Save the Children and WHO and so on, they are working on that. But still, even though the vaccine is accessible here in Khartoum, I don't think there are many who got the vaccine. So I think if we start by small things to do and then see how it goes, and maybe we can generalize it and look at Sudan as a whole. Thank you.
Yeah, thank you, Ali. And I think, as you said, we're gonna start low and go slow and go from that.
Great. How about starting with two different groups, medical group or medical staff versus public, and compare their medical field personnel understanding of the vaccines, why they're not willing to take it, or if not, versus the public.
Yeah, I think you're right. A lot of the people in the medical profession, they just don't want to take the vaccine. They're not convinced or enough.
I guess, we can contact the Ministry of Health and COVID team to know better how many doctors got vaccinated and how many didn't, and so we can rely on this data to formulate our targeted populations.
I agree with Ali. I'm going to jump before my internet cuts again. I agree with Ali. So I think from my understanding, what I like the initial plan that we are reaching to SAPA, since they have more outreach for medical personnel in Sudan, and a lot of people are in their website. So if we started with the medical people that are hesitant in taking the vaccine or advocating for the vaccine, we will consider that a success. I agree with you. It's not all people have Facebook, and a lot of people, they don't have electricity even in the city now to see the national TV. But if we gain 5% or 3% of the medical personnel, really we were able to convince them they can spread the word and work locally in their neighborhoods, in communities. And hopefully by this way, we can increase the awareness a little bit. But that great points, Dr. Muhammad.
Yeah, I agree. Yeah, I think when we start, we will know exactly where we need to target, and we will face the issues. All right, thank you so much, guys, for your contribution. Anyone have any thoughts, any ideas, wants to contribute?
So thank you everyone for the great input from all of you. Really great ideas, and thanks for sharing. So one thing I want to add, maybe as far as how we can proceed as far as steps, I just want to suggest, in the past we used medical students as a way to distribute surveys, let's say. So for instance, we can start with building a short survey, and we can target both two groups. One is medical physicians who already graduated and practicing in Sudan. And let's ask them the same question that you raised, if they are willing, if they are not willing, and what are the barriers, what are their thoughts for themselves, for their parents, and for their other members in the family, something like simple questionnaire that can target the medical staff like physicians. And then we can ask the public using, let's say, a couple of universities, if we can access some of their students, and ask them to answer questions, the students themselves as medical students, and for their families. Let's ask them about if they are like living with their parents or some, what they think is the acceptability and the resistance, if there is any hesitancy. And then we can collect this data. We don't have to get a big pool of data. We can start with simple. We can target, let's say, 150 physicians, 50 medical students, and it shouldn't be a problem. I think we can target the main universities in Khartoum and in Khartoum, in Medina, for instance. So if we can collect from 2 or 3, I think we can get some basic ideas about the most common reasons. And then when we plan our webinar, then this will be as a guidance to start the dialogue and open the discussion for any extra questions or any inquiries from the audience when we are doing the webinar. So what do you think, guys?
If I can add one point here to Dr. Nadir, if you allow me,
Sure.
can we add the point of comparing, or basically mainly targeting the medical personnel or medical professionals, what their thoughts of taking AstraZeneca versus taking the Chinese vaccine versus taking, let's say, Moderna? Is it only about the AstraZeneca or just the vaccine as a vaccine? If you, I believe this kind of, if you agree with me, can be kind of relevant because of the misunderstanding and a lot of the talks about the AstraZeneca and the risk of taking this vaccine. Thank you so much.
So perhaps we can create a Google Sheet or Google form where you can have 5, 6 questions. And then as a group, you can contribute to the possible answers, like check box or empty box where they can just type in their comments. And we can just approve that maybe by next week and see Ali Khalid, maybe Roa, if you have connections with medical students in some institution or others who in this group can also reach out to some of the other groups, physicians or medical students. I think we can start with these two. If we can distribute it the week after, maybe we can collect in 2 to 3 weeks some basic data. And then we can, at the same time, arrange for a webinar maybe in 3 weeks or 4 weeks, something like that, with SAPA, or we can build our own. So, like a stepwise approach.
Yes.
Okay, that's great. Maybe I can suggest one more thing. Patient waiting for care, I don't know, in the referred clinic or anything. Maybe we can interview a few of them. It would give us better insight about the non-medical also. What do you think?
Sure, we can create the form so that they can check if this is a patient, this is a physician, this is a medical student, or something like identify the group into 3 or 4. And I think that's a great idea also. Thank you, Khalid. Or Ali. Sorry.
Yes, thank you. Thank you, everybody. Thank you, Dr. Nader, Muhammad, and Ali. I think we need to go into more practical points. First, we need to create our questionnaire. It's going to be a short one, and like maybe not more than 5 questions. And our target is going to be medical professional and public. Do we need to do two questionnaires, or like 2 different questionnaires, or it is the same? It's just gonna be like,
well, just the first question will be identification,
first question,
like,
yeah,
and then.
Yeah, sure. Okay, that sounds great.
And I think Sumi maybe have a question or comment, but before that, if we, while we're building this questionnaire, maybe we can also search the web, see if there are already similar question or similar questions up there. So we can just incorporate that instead of reinventing the wheels. Go ahead, Sumi.
Yeah, I was about to tell that, like, I searched before my project in Detroit. I searched a couple of the papers, and I'll share with all of you after this meeting, and how I ask those questions. And first of all, when I was working with the clinic that I targeted for the underserved population, so the same questions arise to me that. The office, people are vaccinated, or the residents over there who there is a 2 residency program there, family medicine and pediatrics. So as I mentioned, this is an underserved area in Detroit. So they are vaccinated 100%, even the medical assistant, nurses, PA, and some clinic manager and some other people. First I was thinking, before counseling the patients, or before overcoming the hesitancy for the population around there, first I have to clear the hesitancy for the whole area where I'm going to work with. So I mean, unfortunately, I'm talking about in March, and there are less than 50% of the people who are not vaccinated in that clinic itself. So I try to convince them in different way. So from 50 now it is 70%, but still I want to warn you, still not 100%. And we know that there are 3 vaccines available for the all, because all of them are considered as a frontline worker here: the nurse, PA, and MA, and clinic manager, so practice manager basically. So they are considered basically the frontline worker, and they have all access for all 3 vaccines. They are still not vaccinated, since the vaccines are available since February to them. So it's still not 100%. This is one thing, because they are going to, the person who is going to give the vaccines, such as MA, to a person, actually that person itself is not vaccinated. So where we are standing? So these are the questions we have to answer, and we have to collect actually. And I would suggest that our questionnaire, if we want to divide in 2 groups, like medical professional versus like other or general population, I think it's a good idea to include not only the physicians or residents. We should include also nurses and other front care worker, because they are the population every day they are exposing, right? From the, like, I'm sure in Bangladesh it's called like ward boy. So the person who, when a patient comes to the emergency department, there are some people who just pull the stretcher, or like take the patients from the car to the inside the room. Those are equally vulnerable for this disease, especially in like Asian or African country. So if you have, like earlier, Khalid have access, or we can even like email them those questionnaire. They can just have answer those if possible. I'm not sure like how familiar the people are email or something, or like we can print out those questions, they can just answer. That's how we can collect the data. So I think it would be better if we target one, like as Dr. Nadir mentioned, probably the city like University of Khartoum, or I think so many of you are from there. So, we can target those area or that university, and the whole healthcare workers like frontliners versus the patients, even like who are waiting for the emergency room, or like, there are so many patients sometimes wait. So we can, like, anybody can access and talk to them and then ask their opinion about the vaccines, just utilizing their time. Like what I'm doing here is when people come for the COVID vaccine, first dose or second dose, after getting the vaccine, they have waiting time for 15 minutes. So I'm utilizing that time for their hesitancy, and also their like how do they spread the news to the family, to the community, to the relatives. And it is not for them only. Basically we are reaching out to them, or everybody's one vaccine is important to reach for the closer to reach for our herd immunity, which, like, that we will overcome this pandemic soon. Each of us can vaccinate it. So something, those information, and also some other vaccines, offering some other vaccines. So in patients who are waiting for the emergency room or even the clinic outpatient, anybody can like talk to those questions whatever we are created, and their answers and all that. Just check out their answers, and we can collect the data and work based on the data, I think.
I agree with Sumi, and one of the question or one part maybe will be not only the answers from the person who will check or answers the questionnaire. I think we should also think about the geriatric population, or the relatives in the family, parents and grandparents, or some in the circle. So we can also ask the person about what the others will think if they discuss it with them, and if they have reasons not to, or if they have good acceptability there. So the question might be also generalized to the family members, older. Thank you.
Yes, thank you, Somi. Thank you, Dr. Nader. Okay, that sounds great. I think our next step would be to create our questionnaire. Do you agree that we need to put like a list of questions, and maybe in our next meeting we can vote out of it the best 5, or we think that are the best questions, so everybody can contribute. So by the next meeting we will have a questionnaire ready on our hands. Do we agree on that timeline, or anybody has?
I suggest maybe Ali, he's raising his hand. Maybe Ali, if you don't mind, maybe you create a document or the Google Sheet there, and then start with Khalid, see what the common question, maybe within the WhatsApp group, see if you guys all together come up with some most common question for you guys. And if someone can look up the literature, see if there is any already made questionnaire similar, then we can incorporate that. So by next week, as you said, Aza, maybe we will have the questionnaire ready just to finalize it during the meeting. And then after that, we also maybe we will identify what the target groups. If we have clinics, we have universities, we have some community centers or community leaders that we can approach. And I think nowadays with WhatsApp group or online thing, with the phones available, I think we'll have much higher rate of response rate for the questionnaire. It's not like the paper and you have to spend time with person one-to-one. Thank you. Good. Thank you, Aza.
Yes, thank you so much, Dr. Nader. You're right. An electronic version would be highly appreciated by everybody. We can send it through WhatsApp, like to our family member, and they can respond right away. But Ali, go ahead. Sorry.
Yes. I do agree with you, Dr. Nader. that we can use Google or whatever to send the questionnaire to doctors and students or nurse or whatever. But I have another suggestion for the general population, the non-medical. Maybe if we can interview them instead of, yes, we do have, for example, 5 or 6 questions, but to give them more area to express their feelings or their worries, maybe an interview would be better option. I don't know. What do you think of?
I think it's a good idea when you have available people who can do that and have time to do that. I think it's one-to-one. Yeah, it's good in getting accurate information from the sources themselves. And it's easier to collect the data when you are in discussion rather than the electronic form. The limitation usually will be you need to hire people or if you have time or not. So if you have the time and you have the patient in front of you, yes, I think it's a good idea to go over the questions one-to-one and maybe they can explain much more better. Go ahead, Mohammed, you want to add something?
Yes, my just quick question here. Will we agree on working in 2 groups, medical professional versus public, or we split the medical professionals into subgroups and then the public into subgroups, for instance, geriatrics or elderly versus young adult, educated versus uneducated? Should we consider these factors too, or just go into 2 groups, medical professional versus public?
I think we should think about it simple. It's just initial collection of data for the webinar. I think if we put some question about, are you in the medical field, maybe you can check physician, medical student, nurse, something like just check box, one question. If you want to, maybe we can add another question about the age group. Maybe you can just divide it into 50 plus or under 50, something to identify this age of. I think the simple we can go, the better, instead of going into much details, unless we are thinking of doing something out of the data. If we are targeting, let's say, 1,000 people or 500 or something, then you need to get, yes, some stratification or some details of you want to categorize them education-wise, female, male, some other details, so that when you are writing your paper or abstract, then you have some table to get your data from. But for this purpose, I think we want to get a webinar going on, and the idea is to collect the most common questions or hesitance reasons not to get the vaccine. If all of them say we are accepting the vaccine, we have no problem, where is the vaccine? Then the webinar will be just something to do to make, to check on our list, yeah. But if we have data to support our webinar, that some people say, oh, because of Chinese or because of I'm afraid of this or whatever, some reasons, then before we go to the webinar, maybe we can get some data to support our answers to these common questions. When we present it, then it will be available to other people. When they have more questions, they can ask these questions. This is my thinking. I might be wrong. Whatever you suggest, guys, I'm open to your ideas.
Thank you so much.
Yeah, well, I think like while collecting the data, like, during collection, it's always better to collect more information, but also most like simplified data. And, then we can use, if we decide later on based on our data that we want to write down a manuscript, so data is there. So if we don't want to write a manuscript, we just want to use that as a like, our real work, like how to overcome vaccine hesitancy based on this data, we can also include that in our manuscript. So either way, we can add that in our manuscript. So in that case, probably Dr. Mohammed has mentioned, so we can categorize, like, while we will make the questionnaire ready. So what's their age and probably what's their gender, or like what's their profession. So if we categorize like that, so we definitely know like how many people are medical professional versus general population, something like that. And we can just yes or no, medical professional or not, or yes or no, and then others is others. That is, we don't need to divide anymore. Or like probably then we can categorize as a like 50 and above and 50 and less, if we age like that. Some like, we can categorize as a age group like that, or we can categorize as a gender group, like whose gender is having, male versus female, like having more hesitancy than the other. So like we can do that. Or like the urban people are getting more hesitancy than the like city people, something like that also we can categorize. So it's like we can collect more data and we can publish or like write down manuscript based on that. And also I have a suggestion for Ali, as he said that interview, that's it, that's like that's the best way to do it. But as Dr. Nadir mentioned, it's very time consuming and we need like manpower to do it. But if you think like, especially the medical professionals, if you target, you can instead of getting the interview in person, you can even arrange a Zoom or like WhatsApp or like FaceTime interview, and you can save your time. Let's say if you target like you want to do 5 people interview, each of them like 5 minutes, and like like WhatsApp or whatever, like a FaceTime interview for 1 month. So basically you are collecting literally 200 people data by that. Instead, like during this COVID, it's also hard to like conducting that interview in person. So that's an idea. I mean, I did that, like I especially for the young people here, like when a couple months ago when Pfizer first approved like the vaccines for 12 and above, so they are hesitant, and how hard to deal with the teenagers especially, but as they are very tech savvy, right? But the geriatric populations are not tech savvy, so I had to talk to them over the phone. But the young population like 12 to 18, I arranged a Zoom meeting from the office, and I used to talk to them like what's their hesitancy. And also I came to know that they have different reason to have the vaccines, and how do they convince their peers. Because if you convince one person, they definitely they listen to their peers, than they listen more to their peers than their parents, I can guarantee you. So that's another thing. If the young populations, like you can convince them, so they will spread that to their peers, which should be your target too. Thank you.
Thank you, Somi. I couldn't agree more with the point you raised, especially about peer learning and also about the collecting as much as possible information, because maybe we can publish them, we write a manuscript or see association between, I don't know, level of education and vaccine hesitancy, and what are the most common causes of vaccine hesitancy in, I don't know, maybe in 40 above or 50 above. So it's it would be beneficial if we collect as much as possible data and see what we are going to do with them later on. Thank you. I have a question about the initial survey. You said, Dr. Nadir, that we are targeting maybe 50 or something in this range. Do you mean 50 in medical staff and 50 general population, or what were you meaning by that? Thank you.
Yeah, so basically, we are talking about two different approach or different goals. The first goal, what I understand, is we want to create a webinar so that we can discuss and then distribute information, and at the same time open the floor for questions, additional questions, and maybe raise problems, or erase some of the hesitancy. For that purpose or that goal, I think we need to get some basic data. To get basic data, I don't think we need to collect as much detailed information. I think just the basic information to collect about why they are hesitant, and if they are in the medical field, and if they are not in the medical field, if they are older or they have their families older than 50, something like that. So my thinking is simple, 5-6 questions, something, the basic of the basics, just to collect information for the purpose of the webinar. When we discuss the webinar, then you will have, let's say, Azza will talk about AstraZeneca, and from the questionnaire, we have some problems or hesitance because it can cause blood clot, because it can cause problem with female, because it can, whatever we collected from the data, the basic things. So when she is talking about the AstraZeneca, she will address these main hesitancy points. There may be more question about AstraZeneca later on when you up on the floor during that webinar. Then she will be able to answer, or anyone else will be able to answer the following questions. And then out of the pool, that's the question, or the answers we got from the questionnaire, also we can identify other areas about the Chinese vaccine, about older, about whatever. Maybe we will find something. So it's kind of the initial phase to collect data for the purpose of the webinar. So we don't want to start a webinar with no data or without any target ideas or areas for the audience. That's my thinking of collecting the data using the questionnaire. And so for that, you can either approach medical students, nurses, physician, or the public just to collect 50, 100 responses. The more, the better. But the question will be, some of them might be handwritten, typed, or some. To collect this data, to verify, to scroll down, the more you get, the complex and time consuming to identify these and put them together into categories and so forth. So to start, I think we should limit ourselves to 50, 100, something like a manageable number. That's the first goal for the webinar. If people are talking about publishing and writing manuscript and identify and going for the bigger project, yes, I agree. Then we will think about the questionnaire, how much detail we can obtain from the questionnaire. Then these factors or question will be needed to be answered, like the sex of gender of the person who answering the question, the field, the age, whatever education background, city or rural area. I mean, you can get more and more details and think about what you're gonna write in your manuscript. So the more you think about the manuscript, the more questions you have, the more details you want to get. For that purpose, I think the target group will be the more, the better. I will say 500, 600, so that you have solid data. When you are writing a paper, you will say, we distributed this questionnaire to 1,000 people, and 800 of them responded. So your response rate will be a good one. So when you send your manuscript, it will be legible or will be acceptable as far as number-wise and response-wise. And then you go into the details of, we found this in this certain group, we found this in this certain gender, we found this, something like that. It will be more into detail for the manuscript. So these are two separate projects, if I may say. So whichever project you want to do, you can create the questionnaire for that project. My thinking is nowadays it's a hot topic for the education part. Like Nowadays, it's a time to educate people and do the webinar and so forth. If we wait, let's say 6 months, it will not be a useful one to do a webinar about a vaccine, about maybe COVID. By that time it will be gone. So now if you think about getting a webinar, we should think about maybe we will target in 3 weeks, we will have the webinar. We can talk to SAPA, send them the information, they can get the flyer and then distribute it, because they also need to prepare from their side that from their own purpose, making a flyer, making like identify who will be running the show, for instance, and the time, the best time, something like that. So let's say in 3 weeks. So for us to collect information in 3 weeks, manage the data, get all the information ready, identify the speakers, give each speaker their area. I think the small number might be 100, 200 manageable answers. If we are targeting writing a paper or manuscript or abstract, then we go the other route. We can go into the detailed survey, and we can distribute it as many institutions, hospitals, clinics, WhatsApp group, FaceTime, Facebook. You can get, not get, you can distribute out much. And the more you get the information, the better for your paper. But put in mind, this will take you longer time, and you will write, you will analyze the data, you will distribute, and then think about in the future, maybe 1 month, 2 months, then you will start writing the manuscript and submitting it. So these are two kind of project or ideas. That's my thinking.
Yeah, I get your point, and I agree with you. Thank you, Dr. Nan.
Yes, thank you so much, Dr. Nader. I think we all agree on that. The most important thing is the timeline. And what we need exactly is to target the the people who are eligible to get the vaccine, the age group above 12, and medical profession, of course. I'm sorry, guys, that I had my computer power was out, so I'm charging it right now. So we have our agenda for next week. I think for summary, right now we are agreed on having a questionnaire by 2nd week, and we can look at it and finalize it in our next meeting. And we'll go from there. So anybody want to present the questions? Like we can like criticize the questions, or maybe jump in, and everybody can have their opinion. The list of questions, we will all participate on it, but like in the next meeting, somebody has to read them, so everybody will see the list that we have.
I don't think Khalid Osman is available. He was disconnected, but what I understand from him is that he's going to coordinate the next meeting. So
okay, that's great.
maybe, yeah.
Okay, then we will agree on that on our WhatsApp. So Khalid will lead the next meeting. That's awesome.
Yeah.
Okay. So
can I suggest some? Next week, I think you are right. We can present the questionnaire, the questions, and agree on how to put them and finalize the questionnaire. So maybe someone from now until then collect the question and start the form. So by Saturday, we will have the form ready. And the only thing we need to do is we say, this question is okay, this question, maybe we add this or something like that. It's just light touches maybe we add another question or remove a question, something like that. So maybe someone can present that. And I need another one to volunteer to maybe summarize the idea and why we are doing this questionnaire before we work on it. And the reason for that is next week we can start with a new batch, the new class of fellows. So part of that will be an introduction. I hope people will introduce themselves and see how we are doing the Zoom meeting and so forth. So first part, I will give everyone to introduce themselves. Second part, I will give a little bit background, hopefully very short, about the fellowship, the goals, and if they have questions or clarification, something like. And then I need one of you to present summary of the idea of what we are going to do about the, let's say, webinar vaccine hesitancy. And then the questionnaire, someone else or the same person can present it, and then we can chip into finalizing the version. And then we will set the steps for next, like how to distribute and take it from there, and then send set the agenda for the week after. Does that sound like a good plan or agenda for next week?
Yes, that's perfect. We definitely need to delegate the task from now, because I know once the meeting will be done, some things may be lost to track.
Yeah.
And you're right. So next meeting will be for the new fellows to present themselves, and you give them a brief about the fellowship, and who will collect the questions. Anybody will volunteer to collect the questions? Sarah, you're raising your hand. Sorry, I didn't see you.
So I believe that the idea is very great and amazing. I'll be happy to contribute to it when in any role like that is suitable, like data analysis, questionnaire formatting, or even like I have little ideas about like poster, like graphics and little things like that. So like I can contribute in any ways that you find like suitable. That's what I wanted to highlight. Thank you so much. Also, I just wanted to, there was like something I've seen in one of the meetings. It's another topic in the American College of Physicians. So there is like an starting initiative about post-acute sequelae of COVID-19. And they are like calling for research because there's no enough data or information about that. And they are like, the NIH is starting something called like recovercovid.org, where they are planning to start granting awards and grants to help support for research. So I think this is a good opportunity for us to start research like the post-COVID, the post-acute sequelae of COVID-19, particularly in the geriatrics population. So I just want to know Dr. Nader's opinion about that.
Thank you so much, Sarah. So let's start with 2 points. Point number one, I thank you for volunteering. So I'm gonna put your name for the task. If you can help us with searching the web, see if there is any form of questionnaire similar to the ideas that we just discussed. If there is some, maybe you can just discuss with the group. I found this questions, maybe. And then if Ali, you don't mind, can you create the form and work on getting it like presentable? Maybe Lubaba, if you don't mind, you can give a background summary for next week, if that's okay.
Sure.
And anyone else, you can contribute with the same 3 people as far as finalizing the question or adding the question or changing the format of the question, something like just to complete the questionnaire. If that's okay with everyone, and jump if you want to do anything else with the group, so you can discuss in the WhatsApp group together. The second part for Sarah, that's a good hot topic about the sequelae of COVID, or what happened after you get infected with COVID. There's different terms for that. One of them is long COVID, or other terms they can be used also. But the idea is what happened after, like in the 90 days after you get the infection. And as you said, NIH and other big institution or funding are putting money in this area. So I think it's a good area to invest our effort in getting questions or ideas to investigate, to get information, to get some research project in this area. There are already some projects going on here at MSU and other places. So the more information we can get, the better, the more ideas we can share. So in the coming couple of meetings, we can discuss and see who's interested to get some projects going in this area. That's a very good point you raised. Thank you so much. Mohammed, you want to add something or question?
Well, it's not a question. Just since this is my first meeting, I'm not really comfortable, participating in a kind of taking a specific job, but I'm willing to help in any form of creating a PowerPoint presentation or any of that. So if any of the groups need some kind of work, I'm willing to participate. Just get in touch with me through WhatsApp or my email. I really can help on that. Thank you so much.
Yes, Mohammed. Sounds good. I need your help. We can add you first to our WhatsApp group, and you can work with us on the questionnaire. Definitely. Ali, you're raising your hand.
I was going to say what have already been said. First of all, I think Lubaba is the best to present the vaccine awareness brief overview, because she is the leader, of course. Also, I was going to say to Dr. Mohammed, maybe send us your WhatsApp number and email, because we have a group in WhatsApp regarding the vaccine awareness beside the biggest group for Telegeriatric. So I think Lubaba is the admin and she can add you. Both you and Sarah, you are both welcome. Maybe we can share many ideas and discuss further in the WhatsApp group. Regarding Dr. Nadir's form, yes, I'm willing to create that form and complete it with the group. But I have a question for the next meeting, or two questions in fact. Are you going to leave the meeting, the next meeting, or maybe Khalid? I don't know. I know it's introductory to the new batch, but that's the first question. Second question, I have some points to discuss about the manuscript. So I don't know if can fit the agenda next week, or maybe we can discuss it outside the weekly meetings, maybe with you, Sarah, and whoever interested. Thank you.
So for the next meeting, I will be leading Khalid. I think he stepped out. But for the next meeting, I'll be leading the Zoom meeting. And as you said, thank you for getting the questionnaire ready. Lubaba will present some summary of the idea. If Lubaba, you want to work with maybe Mohammed to get the presentation, if you need some with slide PowerPoint, maybe you can work together. If not, that's fine. In the future, we will get the help from Dr. Mohammed's skills and other people also. I don't mind if maybe Sarah, Ali, if you want to stay longer, or I can ask you to rejoin the meeting later to discuss other topics or projects. If anyone else, because I think it's 4:15, 4:13. If people want to leave, that's fine. So we have a couple of projects, I think, going on, Sarah. One of them is manuscript, I think. Ali, if you have any other addition, we can talk about that. But let's finalize the agenda for next week. So we will have some introduction for new batch. We will have some summary, not summary, but background information for them about the fellowship and setting the basically the field for them. Next, Lubaba and maybe Mohammed will be presenting about the summary of this project webinar about the vaccine. Ali, you will be working on getting the questionnaire and maybe working on finalizing it on during the meeting to just make sure the questions are final. And then we will talk about the week after agenda. Does it make sense to everyone?
Yep.
Okay. Any questions? Any addition? Anything? Muhammad, you want to add something?
Just a quick technical question.
Yes.
Do we use the same password to log into the meeting every week, or different password for different meetings?
Same. The same.
Okay, thank you. Thank you.
You're welcome. So if yeah, go ahead. Sorry, Sumi.
Yeah, sorry to interrupt you. I just want to update the manuscript for the COVID and cardiovascular. And yeah, I understand that a lot of fellows contacted me for contributing for the manuscript, and I will create that, Google documents this week. I was sick last week, so I was not able to do that, but I will send all of you. And also, if I miss someone, you should get it by Tuesday. If you don't get, if someone wants to join, you can definitely contact me. So that's the update. Thank you.
Thank you, Sumi.
Yeah. Anything else or any questions? The next few minutes, we will be talking about like the update, like just Sumi did, the manuscripts and what else going on. So it's kind of, if anyone wants to leave, that's fine. If you want to stay, that's also fine. So Ali, you want to raise some points or go ahead?
Yes, I have been going through the Google Docs you shared with us. I have seen what has been written on the introduction methodology and so on. I think it is well written and good. But I moved to the results section. I saw what the Baba started to write, and I have discussed with her the points, but I wanted to share it with you and Sarah. So do you want to some specific data about what we have presented, what we have learned through the last year, maybe to touch on critical appraisal, interview tips, and any other presentation we had. For instance, I have written, I think, one paragraph talking about the other skills besides the geriatric and research, teamwork abilities, and how leadership were divided between members. So I don't know if we want to comment on that or not necessary. What are your thoughts on on that?
I think all of these are valid points. I think the more we show that what we learned and we can provide to others in the future, or at least to disseminate and see if people can replicate the same program in other institutions. I think that's the goal of this paper is to write about what we are like targeting and what actual people in this group learned during this time. Whatever you think is applicable, every one of you from their point of view, you can just add it, and then we can tweak it so that we can make it user-friendly, leader-friendly. I mean, for readers to follow exactly what we did and how important and how useful this program is. So I agree with you, put it in, and the more you put in, the better from everyone.
Okay, I see. I have been looking through the meeting minutes, the previous meeting minutes.
Can I just interrupt?
Yeah.
So to let Mohammed be on the same page, we are planning to write a paper about this fellowship. So we spent 1 year with 14 or 16 fellows, and we want to write about the whole experience, the whole benefit of it, and if we can distribute this, share it with other people so that they can maybe replicate it or something like that. So the question is, Ali was asking if we want to add more individualized learning experiences, and I think it's a good idea. Sarah was writing some of the basic, the sketch of the manuscript. So go ahead. Sorry, Ali, I interrupted you. Go ahead.
Yeah, no worries. I was asking about, do we need to add specific, I don't know, presentation titles or just the thematic view? Maybe I think going back to the previous meeting minutes, I saw that maybe I think in January and February, we were practicing on SPSS more. And I think March and April, we were doing critical appraisal so much. So do we need to divide that or stay specific? We were presenting, I don't know, for instance, Sumi presented artificial intelligence and Khalid Osman presented how to write a manuscript.
I think maybe it will be not into much detail about who present or the topic, rather the themes or the areas. So we touch on software that's used to get the basics of the statistic. We used SPSS for demonstration, something like that. And while we are doing the posters, we come up with the idea of adding artificial intelligence into this like aspect, something like that would be a good option to add.
I see. Okay, I see what I can do and I'll share it with you. Thank you.
You're welcome. Lubaba and Sarah. Lubaba, go, then Sarah.
Okay, thank you, Ali, for bringing up the subject about the transcript or manuscript, and thank you, Sarah. She did a great job on writing the initial part. My question is, are we allowed to add the other parts or only the results section? I started writing on the results section about how successful this year was, and like about 4 paragraphs so far, but I'm wondering, can we add to the previous sections, like the discussion, the introduction, and everything? And the second question is, do you or Sarah have a timeline when we're gonna finalize this and submit it to the specific journal?
Thanks for the question. So the first one, yes, you can add, edit anything, any other parts. You don't have to limit yourself. That's fine. Okay. The timeline, I don't have a timeline. The sooner the better. If you contribute as much as fast as you can, and then we can actually use as a presentation as far as targeting certain journal and then working on submitting and see if they accept and so forth. So maybe in the meantime, if people are able to use this tool that I presented and see. So one of the things you can copy, let's say the introduction part, or if we write an abstract of this, you can just copy the whole thing and put it in the box in the website for Jen, and it will match all the journal that can accept or has similar papers presented. So that's a way to like identify which journal, and then we can make a list. So,
thank you.
You're welcome.
I agree with you. The sooner the better. I think from our experience of last year, I think we need to specifically put a deadline. Maybe Sarah and us, we will discuss. Yeah.
So maybe someone will work on getting the list of journal. Someone will set dates and see if we can match these dates, and see if we can find some. Maybe Khalid will help us write a budget and see if we can figure out where to pay for it if we target some journals that needs payment. Otherwise, we will go for the free ones. Sarah, you want to add something? And then Aza, go ahead.
Okay, thank you, Dr. Nader. Thank you, Lubaba and Ali, for your contribution in the manuscript. I'm actually looking forward to publishing it. I have a couple of questions, though. So can we add in the results part about the vaccine awareness, and if you are planning to start the post-acute sequelae of the COVID-19, can be that as the future plans for the next academic year?
Definitely, yes.
Okay, thank you. I have another point. So I've been a little bit curious about the publications where we can publish. So can we do we have an option to submit it for instance, for the American Geriatric Society or for JAMA, or so I think they have great impact factor, and this way we can spread the word and we have better leadership in the Telegeriatric fellowship and research. So
I think we can target the highest in order. If we think JAMA is the best, we will go ahead. If we go for New England Medical Journal, we can go ahead. I think it's a very important one. So we can target the big ones, and if we get rejections, that's fine. We can go to the next one. JAMDA, or the geriatric AMDA, is also good because it's the field of geriatric gerontology, geriatric enterology, also another journal. So why don't one of you make a list and see which one we can target, and then put the list, and then we can discuss that. See which one we put first, target, submit, and see if there is rejection, then we can go to the next.
Okay, just one final. Thank you so much, Dr. Nader. Just one final thought. So, how valuable is the order of authorship will matter in the manuscript?
So again, for your application for the residency, it doesn't matter where is your name, front and the back, middle, as long as you publish something, that's important. As long as it's in PubMed and some journal that's peer review, that's something. If it's a paper, it's highly, the impact is high. If it's a poster, it's less compared to the paper. So if, let's say, you are in a project and you publish and you submit a paper in JAMA or New England Medical Journal, your name, it doesn't matter if the first, second, or third, or last person in the list of authors, as long as you already submitted, accepted, and so in your CV, it will show that you have published in a good journal. So your application will be more acceptable. That means you are in the research field and you can publish and you know the system at least. Second of that, less important, but it's also good, is a poster. If you present poster in, let's say, MSU, an institution, it's important, but it's more important if you submit an abstract for a regional meeting. Regional is less important compared to national. If you go to AMDA, it's a national. Geriatric Society, it's a national. And the most important one is the international. If you submit your abstract to an international group, let's say Alzheimer group, and you get accepted for a poster in that group, then your audience will be all over the world. So in that sense, you have a poster, but it's an important poster because it was accepted in an international platform or some organization, something like that. Does it make sense for you? Did I answer your question about the authorship?
Absolutely, yes. Thank you so much, Dr. Nader.
You're welcome. Aza, go ahead. And then Sumi.
Yes, thank you so much, Dr. Nader and fellows. First of all, I agree with Lubaba. She said we should present this in the next AMDA meeting in Baltimore, present the manuscript, I think. So I agree with Lubaba. And I just have a couple of points, 2 points. First, we already have, I just want to notice like everybody, we already have a WhatsApp group about the COVID vaccine awareness. Lubaba, just activate that more and we can discuss the questionnaire and go from there. And second point is about the manuscript. Are you guys done with everything, or do you need, if you need help with any task, I'm willing to help. You can add my name. So that's my 2 points.
So Sarah, if you can share the link for the document with Aza, that would be great.
Oh, yes, absolutely. I will.
Okay.
But just, Aza, can you please provide me your email and I will add you to the group.
Yes, sure. Okay, thank you.
Sumi, you have a question or comment?
Yeah. So my thing was like I wrote a couple of points to like we hearts up each other, Aja. I'm not Aja, sorry, Sarah. But for the manuscript, the results portion, I was thinking that is it okay to include the vaccine awareness campaign also, like the future or ongoing project, something like that. So probably in the results section, we can categorize as like what we have done already, like 8 of our fellows already joining residency soon, and probably ongoing project, and all of us already published abstract, and like we already present in the AGS and AMDA, and also like now we are working for the manuscript for those abstract, like as depression and cardiovascular on the way. And also we can include something like that future, that we will apply for some small grant. That's our future things, and that's how we learn things. And also probably will be trying to activate more in clinical rotation or something, if that possible, through the MSU campus in any wherever it is, like in Michigan. And also like, is that possible to include that, as already I have a small grant for the vaccine awareness, so I can include that also, that already we have a small grant from the vaccine awareness project. So I was just clarifying those, that is it okay to include those things? Thanks.
I think it's okay, and I think it's important to mention both points that we already, as you mentioned, we have one fellow who secured funding for awareness in underserved area, and also we are working on getting educational activities like webinar or other to educate others about vaccine hesitancy or something like that in the future, in the near future. So I think it's okay to write about what we already achieved together and what we are planning to do as far as the goals of this fellowship. Yeah. Lubaba?
Thank you. Thank you, Dr. Nadir.
You're welcome.
Yeah, so those points actually show me, thank you. I wrote briefly about most of those points that you mentioned in the document. I just want to clarify with you, Dr. Nadir, is it okay to present the idea that we are expecting to expand it as to include clinical aspect of the fellowship? I started writing about that, but I wanted to confirm with you before going further.
I think as an idea, I think it can be written. You can write that.
Okay.
And we can say these are our plans.
Mm-hmm.
Whether or not this will be occurring, we will see. Because if we look at it from practical point of view,
mm-hmm.
we have 150 fellowship programs roughly in the US for the past, let's say, 5 years. And during these 5 years, if you look at the number of positions filled in these programs, it more or less it's 50% all the time.
Mm-hmm.
So there is a chance of we can fill the gap for the 50% because there is money left over for these 50 unfilled positions.
Mm-hmm.
How to use that money is the question.
Mm-hmm.
One idea is to focus on geriatric need in rural areas. Same was applied in, let's say, Missouri state, Missouri and other states, where they can accept medical graduates to work under supervision in rural areas, let's say, in primary care. So it's already accepted in that state, and the state funded these programs. So you are working there, you are getting paid there, and it will count for you when you apply to residency. Later on, it will be good for you. So you are helping, and at the same time, you are helped, like get paid while you are practicing and learning.
True.
Can we do that, let's say, in Michigan? If we target the older population, I think we can. It's just a matter of how we can mobilize and get voices at the same time and get heard by the state. And if we can do that locally or in the region here in Michigan, can we also apply the same concept and in other states? I think also it's a good idea. So from theoretical point of view, yes, we can put it and we can write about it.
Okay.
Practical point of it, I think it will take time and effort and energy and more collaboration from well-connected network to get that going.
Okay.
Thank you.
All right. Sounds good. Thank you.
Thanks, yeah.
Mm-hmm.
Any other question about this manuscript? And we can discuss also Sumi, the other manuscripts about the COVID and the risk factor, the cardiovascular, or the third manuscript. Any comments about the rest? Any questions? How are they going so far?
So I'm going to create the documents, and as we all agree probably last week that we're going to combine cardiovascular and all other risk factor together. So probably like I'll combine the data also. So and also like we'll make new figures as it was splitted. So probably one figure I'm going to show them that what are the most common what are the most common risk factor among this all of the geriatric population, and how does it affect for the outcomes such as like mortality and ICU admission and hospitalization rate to each of them. So I'll just create those things and together, and then like probably I'll split the work among all of us, so all of we learn something probably.
Sure, yeah.
And also I am like I looked a little bit last week like where we can submit, so by that way if we know from ahead of time, so we can the manuscript we can prepare like that way, like how should be the citation and all that. So one of course JAMA, and this is like a very popular and hot topic of course. And also like how we can provide them some like what's not in the like previous already published articles, something new you have to provide them, other than it will be hard to publish. So I was thinking of like artificial intelligence and also some other things like how we can put it together. But probably one thing is either JAMA or infectious disease article like journal, but yeah, we'll see. And I mean, importing the citation and all that is easy, like if we even also we can change at the end if we decide like it's too expensive and all that. But we can change at the end also. First thing is we have to start with that, and I think we have to, as I mentioned last time, like our goal is to submit that before our residency application this cycle. So by that way, at least we can write on our CV that it's on the press or it's under review, something like that. Or during the interview, at least we can talk about it.
So you don't mind if I send you a template similar to the template I sent to Sarah, and we added the schedule, the basic for the manuscript.
Sure.
So I'll just send that, and then you can add as we go along and share it as a document with some interested fellows.
And I just want to clarify one thing, that is everybody, will that be okay with everybody if that, if I put my name as a first author, and of course, Dr. Nadir will be the leading, things. I just want to clarify to it everyone before I head. Is that okay with everybody?
Yes,
Absolutely.
no worries.
Yes, so
I don't think all participants are available, but I don't think they do mind at all. So go on.
And again, just I want to clarify, when at your level, when you are applying for residency, if you are the first or the second or third author, it's not as important as long as you publish something and they look at the, when you are joining an academic institution down the road, when you finish your residency and become a faculty, then the authorship will be looked at differently. So at that level, then you think about, hey, I want to be the first author, and people will ask why, because I want to get promoted from assistant professor to whatever professorship, something like that. And then you will work on getting, you will get the idea, you will get the major input for the manuscript, and the rest will be adding to your effort, the other authors, basically. So thank you for your help, Sumi, and you will be leading that. And I think the other abstract, or I mean manuscripts. Go ahead, Ali.
Yes, I was asking about the case report. Would it be a good idea to write a manuscript also, or wouldn't be of much value?
I don't think it will
we
be.
Already,
yeah, we already mentioned. It's accepted abstract, and now if it's published in the journal of AGS or the other, I think you got the idea published. I don't think you need to go further. If you want to do something about it, then you will change the track from one case report to what's the common cases in this condition. Then you collect and see what else, and you can publish it from that point of view. But as far as one case, one report, I think we reached the maximum we can do about it.
Okay, thank you.
Yeah, no problem.
And also, I think it will be hard to publish as a case report. So I think we should spend our time, like, where we know that this depression, fall, and, this other manuscript have a more potential to publish. That's my understanding.
Yeah. Anybody else? Any questions? Any comments? Mohammed or Sarah, do you have any questions, unclear things about what we are doing or what we plan to do? So far, how are you doing with the fellowship so far? You are your first day, Mohammed and Sarah. You are a
Thank you
couple
so
of
much for the question,
weeks.
Dr. Nadir. I'm just trying to absorb as much as I can for
Sure.
now. Everything working great. Definitely beyond my expectations. The fellowship program seems like a really kind of promising opportunity to learn a lot than just doing a research in your own. So thank you so much. Thank you for allowing me to join. Number one, thank you for asking the question, definitely to follow on. Thank you again. Thank you, everybody. Just my one question about the WhatsApp group. I already added my phone number, my cell number, and email. So in case of you wonder how to get in touch with me. Thank you, guys. Thank you, Dr. Nadir.
Thank you so much. Sarah, anything?
I'm just enjoying it, enjoying the fellowship so far, and actually it's like getting me more motivated to contribute and learn more. So thank you so much, Dr. Nadir, for this wonderful opportunity. I appreciate it. Thank you.
You're welcome. Thank you both. So if there are no more questions, anything about other abstract or other manuscript ideas? If not, then I think we reach our end of the meeting.
So the other manuscript, like Depression and Fall, like Ali is leading that project, or how is that?
Sorry, show me.
The other abstract, like Depression and Fall, like are you leading the project? I'm just curious. Like the manuscript.
No, I think Lubaba. I'm not mistaken.
Okay. In regards to the depression, since it has been published already in PubMed, do we need to write another manuscript about it?
Again, if we want to get more information, more data, then yes, we can write about it. If it's the same with what we have as far as the data, I think it's already published. So I don't think we need to go further unless we put some different angle prospect and then get more information, more data inside the literature and see. So it depends on you guys how much effort, time you want to get out. I think go ahead.
Sorry to interrupt. I think it would be a good idea to do a follow-up, maybe an article on that, including the falls. I think the first one is not including the falls, was different abstract. And the one that we published is about the depression and medications use. I think we can do a follow-up or even think about the post-COVID sequelae in nursing homes, for example. So
I think maybe that might be a good perspective as far as you already have some posters presented. So to get the perspective of what happened in nursing homes and what do you think after COVID or when COVID started and the comparison and you took it from different angles. You take the force, you take the depression, you take medication, some other aspects. I think you can also work on that as a different paper, collecting all this into one bag. Yeah, that absolutely, that's a good option, good idea.
Okay, we can work on that one. I think it's better as high potential being something new.
Sure, yeah. Sounds like a plan. All right, so, and the same, if you want me to send you a template, Lubaba or whoever wants to work on that, I'd be happy to share the template for the manuscript, and then we can just put things together and see who is interested in the team and edit as we go along.
Sure, I'm happy to have it started. So share with me. Thank you.
All right, sounds good. Anything else, guys? If not, then I think we come to the conclusion of this meeting. And thank you so much, everyone, for your time and input. And I hope you have a good day or night wherever you are. And hopefully we'll see you next week. Assalamu alaikum.
Thank you all.
Thank you, everyone.
Thank you. Have a
Thank
great
you.
day.
Thank you, Dr. Nader.
Thank you.
Thank you, Dr. Nader. See you next week.
See ya.
you.